Now that I have this urine made, what's it look like? Where the hell does it go? Let's look. I already kind of made reference to it earlier, but there's some characteristics to it. It has a composition. It has a specific volume. You produce about 1 to 2 liters per day. 1 to 2 liters per day of urine is formed. Variations of that are due to fluid intake, your blood pressure, how your temperature outside, if you're taking diuretics, if you have diabetes. The minimum is like 0.5 liters, I think. So, but 1 to 2 liters per day is generally the norm for most people. It has a pH of around 4.5 to 8. Again, this can be affected by, infection, metabolism, your diet. Diet's a big influencer there on the pH. So I never usually ask pH. It has a specific gravity. There's a rate at which substances should fall through the urine. It's due to the solutes. So how much solutes do you have in it? If it's a more concentrated urine, yada, yada, yada. Color is probably the big thing. Color, smell. Those are some big ones when it comes to it. It's, smell. If it smells like new mown hay, that's usually a diabetic. If it has some cruciferous vegetables in it, it can smell a little nasty. Color is generally lighter in color, pale yellow. If it's darker yellow, that can mean either you just consumed a lot of B vitamins, because those are the ones that are excreted. But if it's really dark urine and it burns a little bit, it could mean an infection. It just really means a super concentrated urine in most cases. So your body's holding on to water. Get some damn water. 95% water, 5% solutes, whatever. As the urine leaves the collecting duct, renal papillae, minor calyx, major calyx, renal sinus, we enter into the ureter, which is the entry into the urinary tract. They are just a fibromuscular tube, so it's going to help propel fluid via peristalsis. Retroperitoneal ureters conduct urine from the kidneys to the bladder, so that's its function. So I guess you can remember that. There we go. Sorry, I lost my pointer. It enters on the posterior lateral wall of the urinary bladder, so it comes around and pokes in on the backside. I don't really want to get into hell of a lot when it comes to the histology of it. It has a mucosa. There is I don't have it listed on here. It's special epithelium, right? It's transitional epithelium. It's the only epithelium that responds and changes shape to a change in pressure. And it also has a special area called a trigone. I don't think I see it listed anywhere up here. A trigone. This is a region of at the end of the bladder, towards the bottom of the bladder. It maintains this funnel shaped. This is just to ensure that all the urine, when you contract the bladder, all the urine gets expelled from it. Okay. We have a muscularis layer. When it comes to the urinary bladder, oh God, guys, I'm sorry. I've been at this too long today. I thought I was talking about the bladder. I'm talking about the ureter. Where the ureter's attached to the bladder. Where the ureter attaches to the bladder, that's where we see transitional epithelium. It allows it to expand as it fills, and then peristalsis comes back behind it and pushes it through. Rhythmic contractions for the muscularis layer, adventitia, just areolar connective tissue, some elastic fibers. It allows it to expand as it fills with urine. And there's the ureters there on the back side. There's the trigone. Here's the trigone of the bladder. Again, this is all transitional epithelium as well. And we have a specialized region of that mucosa there that's going to be the trigone. Again, it helps to maintain a funnel shape, which is there to focus urine's movement out. There's some other things about it. You could see it's behind the pubic symphysis, anterior and inferior to the uterus in females, obviously. It's anterior to the rectum, superior to the prostate in males. It is retroperitoneal as well. But I don't have the trigone listed on there. I'm going to write it here. Yeah, so now you're responsible. Trigone. Okay. It's a funnel shape. Ensures the bladder empties. Ensures empty bladder. Here's the histology of the urinary bladder. Okay, again, it's transitional epithelium, just like those distal portions of the ureters. It has a submucosa. I do not care about it. The mucosa of it is highly folded. It allows it, space to expand. It has a muscular layer. This muscular layer is smooth muscle, obviously, and it is called the detrusor muscle. As you can kind of see in the picture, it's kind of organized into 3 different layers. That's not really super significant, but it is called the detrusor muscle, and that I will ask. We have an internal urethral sphincter. We have an external urethral sphincter. We have the internal urethral sphincter is under smooth muscle control, and it's under autonomic control. It's involuntary. As the bladder distends and expands, when it fills with urine, it's going to trigger that involuntary internal urethral sphincter to open up, put more pressure on the external urethral sphincter. And that's the one you learn to control when you go pee-pee. The external urethral sphincter is what is the exit point for the bladder. I'll go ahead and picture here. And there's your internal urethral sphincter right there. Okay. And there's your external urethral sphincter. Okay. Once you relax that sucker, then it's off to the races in the bathroom. Okay. After the internal urethral sphincter opens up, urine starts to fill just a little portion of the urethra, triggering some pressure on the external urethral sphincter, which then you cinch up even more. Okay. And the urethra, what's its function? Right there, conduct urine to the exterior of the body. Female urethra is much shorter than the male urethra. There's the male urethra. Okay, there's the female urethra. It's generally just referred to as the female urethra or urethra. We don't divide it up into, even though it goes through it has a membranous part, like in a male. We just usually refer to it as the urethra. Okay. The male urethra has a prostatic urethra, a membranous urethra, and a spongy urethra or penile urethra. Okay. Prostatic urethra is a portion of the urethra that runs to the prostate gland. The membranous urethra runs to the urogenital diaphragm, which is just a muscular layer. Okay. And then the spongy urethra runs through the penis, runs through the corpus spongiosum specifically. But it does the same thing. It delivers urine to the outside of the body. It also delivers semen as well, sperm, and its secretions. Okay. Want to go pee? Of course you do. That's why we've been talking about. Of course you have the urge. Drip, 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 drip. Micturition is the fancy word for going to go pee, urination. It involves two reflexes. The interesting thing about micturition, it really involves everything. There's sympathetic, there's parasympathetic involvement, and then there's somatic involvement even, because can you speed up your pee? Have you done that before? Of course you have. That's under your conscious control. So you can contract abdominal muscles and whatnot, pelvic floor muscles, and you can increase the speed at which you get urine to flow from you. So here's the storage reflex, guys. Again, I'm not going to ask it as a short answer. I'm just going to ask it as a multiple choice type question. You have a continuous sympathetic stimulation. This causes relaxation of the detrusor muscle to accommodate the urine that fills it up. Pretty fun. This also stimulates contraction of the internal urethral sphincter. And we hold that urine within us. So here we get a sympathetic response to cause relaxation in the detrusor muscle to accommodate the filling up of the bladder. This also stimulates contraction of the internal urethral sphincter, pinches it up, so you keep the urine within you. The external urethral sphincter, you can see right there, is under pudendal control, so it's under a different nerve, and you can see that right here. Remember, these are the last four of the sympathetic branch of the autonomic nervous system. And you can see it going into the detrusor muscle, causing relaxation of it, and stimulating the internal urethral sphincter to contract, to hold it in. As it gets really filled, 100 milliliters ain't that much. But as it starts to fill up, as it gets anywhere between 200 and 300 milliliters, now we're getting some major distension here. And once this happens, the baroreceptors in the wall of that urinary bladder activate. This does a couple different things. Okay. It stimulates the micturition center within the pons. Everything's within the brainstem, right? And now we get an alteration of signals. Parasympathetic is going to cause the detrusor muscles to contract. So now we're not going to accommodate anymore. Now we're going to start compressing down. As we start to compress down, this kickstarts the internal urethral sphincter to relax. Frankie says relax. Urine starts to enter that proximal portion of the urethra. Now, what does that do? That really puts a ton of pressure on the external urethral sphincter to the point that it causes it to contract. And again, this is the one that you can control. Okay. When you learn to control your bladder, you pinch that up. And now the external urethral sphincter contracts. Conscious control of this thing, because if you have lumbar spine damage, you've lost all control. Through that pudendal nerve, I cause relaxation of the external urethral sphincter. Facilitated by voluntary, this is where you contract your abdominal muscles because it's going to flow at a very slow rate. So we affect our breathing, right? Like I just did there. And you perform like a Valsalva's maneuver and you start pushing down. After you empty the bladder completely, because that's what you always do, the detrusor muscle relaxes, everything flip-flops, and now the internal urethral sphincter pinches back up, detrusor muscle relaxes, and we can start filling this bladder up again. And we can do it all over again. There you go. Oh, there's some terms here you should kind of be familiar with. They ask them, I'll ask them either as a matching or a multiple choice type question. What happens when you get an infection? Urethritis. Much more common in men because of the much longer urethra compared to a female. Cystitis is a bladder infection. And if for some reason that spreads up to the kidneys, that is called pyelonephritis. The biggest thing is dysuria, pain urination, frequent urination. Gosh darn it, frequent urination. Okay, those are kind of the two biggest things. With pyelonephritis, you're going to experience some very bad low back pain, probably some nausea. I mean, this is a pretty serious infection. So those are the two probably common symptoms associated with urinary tract infection issues. Incontinence is just the inability to control your urine, your urination. Usually, there's a bunch of different causes for it. I don't really want to get into that. Failure to eliminate is referred to as retention. Gosh darn it, why is it doing that? Is retention. Okay, so just some terms that you may see. I may do a little matching section with some terminology here, or you may see it as multiple choice type question. Okay, won't ask all of them, but a few of them I'll ask about.